then I will lecture, potluck. Yeah, potluck, then we're gonna lecture on urogenital and sexually transmitted infections, and that'll be it.
Perfect point of discussion.
Oh, and then the review.
Now, hold on. So you all need to watch the nervous system and also the gastrointestinal on your own time, sometime before next Tuesday.
Next Tuesday?
Yeah, because there's case studies.
So the
On
case
Tuesday?
study's gonna be on
No, that was
Thursday?
Thursday you said.
I thought you said the test.
Case
Monday.
studies are gonna be on Thursday, but you have to know about them for the review,
Yeah.
because then we're not gonna have any idea.
Yeah. We're gonna review something in class.
Yeah, but they're not.
So listen, on Thursday, because I promised Tram, and I don't want her to quit, so I promised Tram that we would do a case study in the class. So I'm gonna bring one that is gonna be about E. coli. It'll give you a good idea of how it works, okay? So once we get potlucked and once we get potlucked, once we get the lecture and the case study and the review, then we're done. And then you come back on Thursday. And the other room, the lab will be open because lab's over, and that's where we're gonna have that class, that way you can work in groups easily, okay? So you'll have, each cohort will have 2 case studies. I've written 30. And I'm probably writing one more because I had a good idea this morning on the way here. I'll probably write one more. And the way I'll do this to make it fair is I will ask questions that might be on the exam. And the person who answers it first, they get to come and pick the case study first. And you won't be able, you'll just get to pick 1, 2, 3, or 4, or 5. You're not gonna know what they are. You just pick them up and you'll go back to you. Then you'll have about 20 minutes to complete the case study, okay? And when you complete the case study, you're not allowed to use your notes. However, you can use any digital resource that you have, okay?
Wait,
So you can use your phone, you can use your computer, whatever.
Wow.
can you repeat
That's
that
kinda
one?
like
Well, listen, if you're gonna be in a clinical setting, you're not gonna have a bunch of notes, you're gonna have a digital resource, right? So then, the way you do case studies is you always figure out what system is it affecting, and then you think about the pathogens, and then you go from there.
So on the case study, we get to use digital notes and digital.
Digital resources, yes. Good?
And for the multiple choice too?
No, thank you for playing. Thank you for playing. So on Tuesday, we'll review and I will give you questions that will be like questions or questions that will be on the multiple choice part. Okay, there'll be about, I think I'm just gonna make it easy. I'm just gonna say there's gonna be 50 of them. So that way the case study is worth 50 points and the questions will be worth 50 points. Put them together, you get 100. Okay? I might make it 55 and then we put them together, you get 105. Yeah? Something like that. There's over 400 questions written, so everybody will get a different. So if you want to, on the day of that, the last day of class, next Thursday, you can bring your own computer, or you can use the ones that are here. Okay? So we'll be over there for case studies, we'll come back here for that last part. And then after that, we're done, see you later. Done. It happens. Just when I got you where I want you, complain about exams, but make a really good grade. Then you leave me. And that's the way it is. Okay?
Thank you.
I leave them alone. Okay? Good? Question. That was so cute. Anybody have questions? All right, and then I will, so this weekend, I'll be able to grade those pretty quickly. And I'll get your final lab averages posted. So everything will be ready to go. All I gotta do is take that last grade and figure it in, and then you'll have your final course grade. Pretty quick, right? So it's one of the reasons I'm doing it online, because then I don't have to grade it. It grades it by itself. Okay? I also have come up with what I call diagnosed by PowerPoint, which I think you'll enjoy. And so we will do some practice of that during the review so that you'll know what to expect. because I don't want you to see these questions and then go, oh my God, what the hell is all this? But really, I'm telling you the story of the infectious agent with all the different things that are on this PowerPoint. One slide with all these different images that point to something. Okay? Good?
Mm-hmm.
Anybody have any questions?
Mm-hmm.
All right. So then we have this today. This is systemic infections, it's cardiovascular infections. It's infections that start someplace, but either move into the bloodstream or start in the bloodstream and then move out of the bloodstream. Okay? And so if we think about that for just a minute, the term septicemia or sepsis simply means that, does anybody else need to sign this?
Oh, wait, you.
What I got turned.
So the term septicemia or sepsis simply means that you have an infection of the blood. Now those terms we're trying to get away from because we want them to be more descriptive of what's going on. So we would prefer the terms bacteremia for bacteria in the blood, parasitemia for a parasite in the blood, fungemia for a fungus in the blood, and viremia for a virus in the blood. But we're not gonna ever really truly get away from the idea or the concept of septicemia because there's still too many medical professionals that use those terms. And even the biggest culprit to me is really the obstetrics and gynecology sections, which tend to want to use those terms all the time, right? And so you just can't get away from it. But that's the way it is, okay? In the United States, there's about 500,000, that M stands for thousand, not million, right? It stands for 500,000 new cases, right? There's about a 25% mortality rate in the United States. But 10% of those individuals that die have already some other underlying comorbidity, right? They're either diabetic or morbidly obese, there's some, they're fighting cancer, they have some other autoimmunity, there's something wrong with them, right? And so that could include long COVID right nowadays. There is no real research that's being done with mental illness and how that might affect these systemic infections, which I think really needs to be looked at because as we're finding out, mental illness has been really masked or hidden for a long time, but since COVID, it has really come to light. Okay? So the cost for dealing with these nosocomial or these infections that are acquired in the hospitals is over, let's just look at the lower end of that, $5 billion to deal with it, and that's in the United States. Now, say what you will about our health care, and you know, I am a moderate, but I think when it comes to medicine, I'm more socialistic in my thought process, because I believe that everybody in the United States should have good health care. And that shouldn't mean that people who have a lot of money have better health care than people who don't have very much money. That's just not the way it is, but that's the way it should be. Right? And I know that that is kind of a call to arms for some people, but really I'm capitalistic in other places. So it's just the way it is. If we think about the way this works, is the infectious agent gets into the body, you know the infectious process, it has to establish itself, it has to begin to grow, it has to have a constant supply of nutrients, and then the body responds, right? When the body responds, the immune cells get initiated, right? But during that process, you can have inflammation occurring, you can have clotting occurring because of the virulence factors of the organisms, and all these things are happening at the same time. So really, in the end, it's really about what's better equipped. Is it your own immune system, or is it the organism that has overtaxed the immune system and therefore you get sick? If you get really, really sick and you have septic, there could be all kinds of things that happen. One of those things is that you can go into septic shock, and so that's normally gonna happen with your gram-negative organisms. And just hold on to that thought for a minute, because you're gonna see that concept build in just a minute. But so you get this endotoxic shock, your liver and your kidneys get affected, and one of those will go first, and then the other one will follow. And once both of those follow, then your heart gives out and you die because of an infarct. or some other thing that happens with the way that the blood is not able to get where it needs to go. Right? Leads to coma, leads to death. Okay? So here you can see, again, the concept, building on the concept of endotoxic shocks, septic shock, if you will. And you should know for the exam that if I ask the question, what's the leading cause of septic infections, that it's gram-negative rods. I'm not gonna give you any one specific one. I'll talk about one of them it could cause in just a minute, because it's really become one of those organisms that have been highlighted in recent years. But there's just so many of them, and we've worked with about 13 of them in our lab, and every one of those are known to cause septic infection. Now remember, the ones we use in the lab, we've taken away all the virulence factors. They're not really dangerous unless, you know, stick them in the eye or something like that, right? But they're not really gonna cause you problems. In addition to that, you can see that coagulase negative Staphylococcus aureus, Enterococcus species, both Faecalis and Faecium, and fungi, really Cryptococcus, are also common causes of septic infections, right? And I believe, that septic infections are gonna become more prominent than they are now because of these reasons, right? The larger numbers of immunocompromised patients in our population. And that's not just talking about AIDS patients, that's talking about people who are fighting cancer, people who have myasthenia gravis, have Crohn's disease, or in some cases, you know, individuals who are pregnant, at least for that period of time when they're pregnant, they're immunocompromised, right? And so it's important to understand that, and that doesn't include the alcoholics and all these other groups, morbidly obese, I mean, there's just so many, right? The more frequent use of invasive procedures and devices, right? So prior to the pandemic, one of the most common operations to have is cosmetic surgery, right? People were making themselves looking good, right? So,
Sometimes.
well, yeah, sometimes. Right. So, you know, when you have a 43-year-old person who wants to look 24, that's possible, but there has to be some things that have to be augmented, right? Mhm.
Could cesareans be added to that list?
Which one?
Cesareans?
No, that's gonna be added to this other, well, yeah, I guess it fits there. I guess
More
it fits there.
frequent use of them?
Yeah, I guess it fits there. Because this other one, right, the greater availability of life-sustaining technology, I'm really thinking dialysis, right? But there's so much more than that. So, I mean, I had my shoulder replaced, right? I have a great shoulder. I have about 85% range of motion. That's more than I could have ever hoped for. Right? This other one, I can do all kinds of things. This one, not so much, but I can still raise my hand if I need to. Right?
Mhm.
That's pretty interesting to think about. Higher infection rates of antibiotic-resistant bacteria, and then also you can see the increased proportions of people at the extremes of age. Now, that's not, in the United States, that's not talking about the very young, that's talking about the very old. Because we as a nation are getting older. Now, the birth rate in the United States is about 1.1, 1.2, but that's ticked up just a little bit from its low of 0.7, right? We're just not having many kids in the United States. The millennials and some of the Gen Zers have all decided all at once, okay, now we're gonna have babies, and so now they're having babies, right? So it's ticked up to a little bit higher, like 1.4 or something like that. That's still not very much, but we're getting older, right? And so if you can think about what's happened in the last year, the baby boomers have all decided, I've had enough, I'm retiring. And lots of baby boomers, the last real group of Americans who were set up financially to retire. That doesn't mean that all of them were set up, but that means a vast majority of them are. And now all those guys are traveling, they're doing all kinds of stuff, right? Because they've earned their privilege of doing whatever they want because they've got money that they can spend. Right? Well, those individuals are gonna have several years that they're gonna be able to do that, but eventually, you're going to start to see them need medical care if they don't already need it. And that's the group of people that you all will be dealing with. And I know that all of you probably have ideas about what populations you want to work with, And really with nursing, you can be a generalist, but you're probably gonna be better at nursing if you become a specialist in some different aspect of healthcare. Whether that be OBGYN or hospice or orthopedics or gastroenterology. Well, one of those overlooked disciplines is geriatrics. And geriatrics is not like hospice where you can be really sad all the time because you know that the patients you're dealing with are going to die. With geriatrics, you might be able to work with that patient for a period of time that might be 10 to 20 years, but you're going to see their mental capacity and their physical abilities decline over that period of time. And a lot of times it's happening not only with hospice individuals, but with our geriatric patients, is we tend to not treat them very well in the United States. We tend to isolate them and then forget about them. And so a lot of them leave this planet with nobody by their side. And you need to remember that, because if you, what's that?
I said, now everybody group pray.
No, I mean, I'm telling you the truth, right? Because this is what happened to my aunt, right? She was vibrant, and then she got a little bit of dementia, she got a little bit of Parkinson's, she couldn't stay on her own, she wouldn't come live with me because I had too many rules, right? So she decided she wanted to be in an assisted living, and it was just downhill from then. And even though I went to visit her every other week, and I would take her out to lunch and all kinds of things, it wasn't enough. She was miserable.
Well, that's the thing, nursing homes and assisted living are where old people go to die. That's not where they go to live, that's where they go to die.
Yeah, there are some assisted living and elderly communities.
The communities
God, they're
are
like
great.
resorts.
Yes,
My-
the communities are
My,
great.
my aunt,
We gotta do anything.
who worked really hard all her life, sold her house and sold it for a nice profit, and now she's living at this place called Viera.
Mhm.
And Viera, oh my God.
You wanna go live there, yes.
Are those, I've always wondered about those, cause I'm like, those are really not, like, we've all joked like with our friends that we're moving into them. But if you have a problem where you do need more regular assistance, are you able to move in there? Like, did
Yeah.
you have
They
regular?
So-
have nurses.
So what the contract that she signed
Find out like a
for
ladder.
$4,000 a month for a cottage that she doesn't own, she just pays for the privilege of living there, is that they will feed her, except for 2 times a week when she goes out, even though she goes out all the time because she's a spry 80-year-old, right? I always call her on the, and she goes, hey, I go, what are you doing? She goes, I'm going, she's going someplace.
Right,
But anyway.
margaritas.
Huh?
Yeah.
So she's all over the place, but, and my brother is living with her right now, and now they're like up 2 peas in a pod, I'm like, oh my God. So they're everywhere, right? They found a casino close by, now they're going to the casino.
Lord help them.
There goes the retirement.
Yeah. So anyway, but the point I was trying to make to you all, if you are working with these elderly individuals and you know that the time is close for this person, spend a little time with them. If you have the opportunity to hold their hand in that last few moments of their life, you should do that. I got to do that with my father, who passed away with me whispering in his ear. But you can't do that all the time. My mother fell and hurt her shoulder, and she didn't want to come live with me because I have too many rules. So we put her in an assisted living, thinking she would be there for a month and then we would take her out. She passed away in her sleep. We don't know how. All I know is that my sister called me and said, Mom's gone. My best friend, who had end-stage renal disease, he had a heart attack. We took him and we put him in a hospital. He was getting better, but he couldn't move. So we put him in an assisted living and he was making progress. And we thought, okay, maybe another 2 weeks and he can come home, but he died. And there was some things that just didn't make sense about that death. But because he died in an assisted living and he had a DNR, there was no further workup. So his mother said, do you think we should do an autopsy because the state wouldn't do an autopsy? Right, well, this is a gentleman who had lost fingers and a leg and some toes to two infectious agents because of diabetes and because of end-stage renal disease, right? But didn't take care of himself. So his mom said, what should we do? And I said, well, since the state's not gonna pay for the autopsy, it's gonna cost $10,000. And I said, you know, I will help, but really, are we gonna gain anything that's gonna bring him back? And she said, no. I said, but we're gonna be out financially. And so really, are you gonna sue somebody if we find that there's something that happened? She said, probably not. So then let's not do it, let's just go. Let's just live with the ramifications of his death.
Those are really tough decisions.
But I'm very pragmatic, that's why people like to talk to me, because, you know,
Well, it's
You
really
take
hard.
emotions out.
Well, it's really
and
hard
I
to
do,
make those
although, you
decisions.
know, later on, it really affects me. But you have to take, it's really a family business decision at that point. Your parent or your loved one is not gonna care that they're in a $12,000 casket
Yeah.
and buried. But the funeral directors will make you think that that is what is customary, right? And so they don't like to deal with me because, you know, with my mother, I told my sister to see if she could make the final arrangements. When I saw the bill, it was over $15,000 for the funeral arrangements, I went back in and I said, you know, we need to look at this again. Well, your sister signed already. I said, show me your signature. My sister didn't sign it because I told her, do not sign until I read it. And I came back in and I said, let me look at your simple caskets. And they showed them to me, they were $8,000. I'm like, no. I said, so my mother wanted to be cremated, how much is cremation? She said, $5,000. I said, that's what we'll do. I said, okay, we have these beautiful urns. Showed me an urn, it was like $900. I said,
Put her in a bag and we'll bring her home.
I said, I have my own little container at home that I wanna put her in. So we don't really accept outside containers. I said, okay, show me your simplest thing you put it in. And I said, what are, she showed me this other thing for $200. I said, what are those things? She said, those are the transfer boxes that we use to transfer the remains to other places in the city or country or whatever. I said, that's what I want.
I will say the biggest decision you can make about cremation is getting some sort of fireproof box. My husband's grandparents lost their son's ashes in a hellfire.
Well, so, see, that's the deal. My mother did not want to be put in the ground. So I spread her ashes in the backyard.
I've always told my
I picked up
husband
the
same
bones,
thing.
because I didn't want anybody to get freaked out, right? But I picked up the bones.
So random, but DNRs, I'd be interested to hear people's perspective, because I feel like I've heard some really bad cases about DNRs going badly, where.
The only thing I can say is if you know a family member has one, tell them to keep a copy with it.
All the time.
A copy of it all the time, because a EMS person will do life resurrecting
No, I mean, like,
things
I've heard
until they
people are
see
like,
it.
oh, they're DNR, like, I'm gonna
Okay.
leave them.
So here's the thing,
That's
there's
good enough.
different people
She's a
in the
nurse.
world.
Yeah, that's what I'm kinda looking
Okay.
at Valencia.
There's different people. There's people that are going to leave them as DNR. That means do not resuscitate. We actually have to put another note there because there's people like me that are going to try to resuscitate them.
Yeah.
If I see that they're in pain and I know that they're a fighter, I'm not going to let them die on me. I don't care if they're a DNR or not. Now, if they put DNH, which is do not hospitalize, I cannot send them to the hospital. That means that I can give all of my effort to help that person, because at the end of the day, you have to talk to their family
Yeah.
and tell them that, oh, I watched your dad die.
But I didn't do anything. 'Cause they didn't-
Basically,
Yeah.
yeah, I'm not that person.
Yeah.
I'm sorry, like, I talk to my patients so I know which ones wanna go and which ones don't. If I know they wanna go, I will let them go peacefully, I'll keep talking to them. I remember the first one that passed on me, it was really heartbreaking because she'd been in that building for 40 years. Like, there was nothing to help her, and she was just like gasping the whole time. She couldn't talk, she couldn't do anything except gasp. And she was gasping for about 12 hours. Like, her body was going out. And I'm like, why is nobody giving her morphine?
Yeah.
You know, nothing was helping, and then I just, started talking to her, and she finally stopped gasping. And I said, "Do you want water?" She said yes. By the time I came back to give her the water, I literally walked down the hall, came back, she was going. I grabbed her hand before she died. And I was the last person that she looked at. She's a DNR. There's nothing I can do at that point. All I can do is check her pulse and keep it going. It's up to you and the facility. That's why you need to know the people at the facility. Don't go there and think that, they're just gonna care for them. They're not. They're CNAs that do not care. They will beat up your grandparents if your
I
grandparents
hope
like
that
them.
that is, I mean, I know that it
No,
happens.
that's
Yeah,
real.
like that,
That is
Alzheimer's
real.
and It's not
dementia,
just
and I would see
CNAs,
where
though.
they would just
It's not
like
just
take them
CNAs,
to
but
the room.
they're the ones that are usually handling the patients, cause a lot of nurses
I
don't
would
wanna
just
touch the
assume
patients. They
So,
don't wanna do anything.
This is why I'm having this discussion, because it is a great responsibility to become a nurse. A nurse, along with a teacher, is a vocation, right? It is more than a career. A vocation comes from the Latin vocare, which means a calling. You have been called to help people. And you have to take that seriously. Because there's a lot of people who want to be nurses because it's a really great paying job. And it is. And you can change your discipline a lot. If you're tired with being hospice, which I want everybody to try to be a hospice nurse, but you can't take it that long. It's too depressing, I get it. But people want to go into cardiovascular, they want to go into urogenital disease. There's all kinds of things you can do. But remember, you've been called. You take that responsibility. It's not about you will earn a very good living. But it's more than that. It's about the vocation. It's about the calling. And if you know somebody who is in the process of going into healthcare or teaching, who just simply want to do it for a paycheck, then try to talk to them, because they're going to be unhappy and they're not going to be good at their jobs.
And if you're working somewhere and you see one of those people, report them. Just because it's a lot of paperwork doesn't mean, I know like my husband's uncle passed away in 2018, and right before he passed away, he had some bruises, and he was nonverbal because he had a stroke and a massive heart attack, but we taught him sign language. So he could tell us like somebody was hitting him, we just had to figure out who, and it was an RN that worked at that facility. It turns out that he had multiple complaints at the other facilities that he had worked at, but nobody wanted to report him because it was too much work. Report people if they do something bad.
That's the only reason that I think student evaluations on professors is viable. Because, I mean, we learn a little bit about what we do for you all, but more importantly, what it does is it serves to document if people aren't doing a decent job. Now, there's always that one individual that's just not gonna like you. But, you look at that and you look at the other things that are said, and if they're all saying the same thing, that's different than if you have one person that says, he was the most awful thing ever, right?
I feel like people are more likely to do those because they're anonymous. You're
True.
scared of repercussions.
Well, I mean, I
Just-
think I told you, I handle all the complaints for the Bellevue, and I was told this semester that I was worthless because I wouldn't give in to what this student was saying about their instructor. And I said, I just can't believe that this is happening on this individual because they have never had a complaint before. And the things you're telling me just seem really, really hard for me to grasp. And I talked to the instructor, and I talked to witnesses in the class that saw what happened. And the instructor's point of view and the student's point of view were different, but the witnesses in the classroom more sided with the instructor than the individual. So it's really interesting to me that some students believe that they can get people fired just because they don't like them, right? It's
Welcome
just.
to our generation.
Cancel culture.
Yeah,
Yeah.
yeah.
Mhm.
All right, so let's go on. So here is that organism I was talking about. This is Klebsiella pneumoniae, but you can see here, it's carbapenemase producing. This means that it basically can destroy the last antibiotic that we had to treat it, which is an antibiotic called colistin. Colistin itself is used very rarely. It is the last thing we use when there's nothing else. Now we have variants that are resistant to this. And this thing is wreaking havoc, right? And so you can see that when a patient is when they are the most susceptible, when they are hurting the most, or they're like toward the end of their life, that's when this organism moves in, because it really can hurt you. So you can see ICU wards, medical wards, surgical wards, pediatric wards, transplant wards, burn wards, tumor wards. So you don't see this in an orthopedic ward, right, where somebody has got some pins that put in their leg and stuff. It is when the individuals are really, and you can look where they pick them up: blood, sputum, wound secretions, chest, and
Everything?
abdominal. Huh?
Everything.
Well, but not everything,
Except
right?
here.
But just think, it can infect every single tissue of the body. Yep.
What's the name of the antibiotic?
What's what?
The name of the antibiotic.
Colistin.
With a K or?
Let's see.
See,
And you said what about the antibiotic?
that was the last one we had that we could use. Yes,
To
ma'am.
fight against Klebsiella?
Fight against organisms that there is no other thing. Yes, ma'am.
Can you give me a different word for ward? For ward?
Ward,
Like
unit.
a,
Unit.
Yeah.
I just needed to.
Yes.
it's like a,
Area,
like a building.
yeah. Okay? So there's a really good reason we studied Klebsiella pneumoniae. It's an important infectious agent. Now, the ones we study in the lab, we've taken everything out, right? They are not happy like they used to be, where they could just do whatever they wanted. We have taken away all their virulence factors, and that's why we use it, to study, so that you can see how they act, what they do, what their morphology is, right? All those things that are important. You are gonna be nurses or dental hygienists or whatever, you're not gonna be doing a lot of the diagnostic work. But if you get an opportunity and some physician really thinks you kick butt, they will call on you all the time. And they might walk in and say, okay, I'm gonna make my rounds, I need Valencia. And Valencia will have to stop what she's doing and make rounds with this particular physician.
That's what I'm trying to do with Sarah.
Yes. Because that doctor is comfortable. And I'm the same way, right? I only like to work with people that I can really trust, right? So that when the physician tells Valencia, will you make sure this, and this happens? Look, she's taking notes and she'll get everything done. He goes and he makes his orders and he goes ahead and does his orals, right? Talks about what he's done. All that gets stored, right? And then he'll say something like Valencia to follow up or nursing to follow up. Right? If you get that privilege of being able to be called on by a physician. When I was 17 years old, I said I was 18, and I got to work at Swan Hospital. And I was one of the first young traction technicians, and I would be called all the time by the orthopods. Hey, can you come in and help us? Okay. So I would call in, and my supervisor would say, yeah, I know, they've been calling all morning, come on in. And they would just pay me for the OT, right? And I would go in, and I got to do some really cool things with those orthopedics. One of them, Dr. Sheffield, would call me from his boat. He would be fishing on the boat. He says, Felix, I just got a call. We're gonna have to do this emergency surgery, and I was wondering if you could be there to help us with the trapeze and all this other stuff. So I knew where the patient was going. I'd go in there, I'd set up the trapeze, I'd set up everything for them, and then I would be there when they did the procedure. Sometimes they did procedure on the operation suite, sometimes they did procedure in the room. And those are the cool ones, right? Steinman pins, all kinds of really cool things, right? And in the old days, they had the little screw it into the bone. Nowadays, so it's really interesting to see. But if you get that opportunity, take it, because you'll develop this reputation with this physician, and this physician will talk really great about you. And when you get enough physicians talking really great about you, you can write your ticket to wherever you want to go. Okay, before I left Swan Hospital, they were trying to keep me. They were going to do all this stuff for me, but I just said I have to go. I'm a microbiologist. I wasn't yet, but I knew I was going to be one. Okay? Questions? I'm not going to talk about blood gases. You all will talk about it in physiology, anatomy and physiology, and I'm going to leave it there because I just think when you talk about pressurization and you talk about CO2 and O2 and the way it's exchanged, it just needs a lot more detail than what I can give. So I'm just going to say I'm not going to talk about it. Okay? Well, we'll move on to talk about gangrene, right? Gangrene is an anaerobic infection, and so this typically happens to people who are avascular. And what that means is that they've lost the ability for their circulatory systems to actually cleanse the body properly. And so therefore they have a great amount of edema. Sometimes they have no feeling, they have neuropathy in the lower extremities of the body. It can also be in the fingers, but it usually is going to be in the toes, right? And so here you can see the fingers on the toes, right? Now this is necrotic, they can't feel anything, but the rest of the foot is still alive, right? And so sometimes we'll amputate to save, right? And so there's lots of things we can do. Now these are usually a combination of infectious agents that are all anaerobic, with Clostridium perfringens kind of being the etiology. So if I ask you for the etiology of gas gangrene, it's going to be Clostridium perfringens. But there are antibiotic staphylococci that we call Peptostreptococci, and there are anaerobic staphylococci that we call Peptococcus. These things can all trigger and play a role in gangrene itself. Now, gangrene is a term that can be used for just necrotic tissue. You can get gangrene from having frostbite. You can get gangrene from dropping something on your toe, and then your toe, the tissues in your toe die because they become apoxic, right? There is no blood supply or no oxygen getting there. You can also get it from chemicals, right? But you can also get gangrene as an infectious form. Yes, Sam?
I just wanted to say back to the nursing situation, if anybody goes into being an assistant to a cardiologist or something, after somebody comes out of heart surgery, they put them in socks for circulatory purposes, and then they put a sleeve, like a hyperbaric squeezy thing.
We're going to talk about hyperbaric in just a minute.
Well, I just wanted to say, if you're gonna be a nurse, check your feet every day, because my granddad had a quadruple bypass, and then no one was checking his feet. And when they took the stent out of his heart a couple days later, it wasn't something they could do immediately, he wasn't stable enough. So his body had tried to clot and remove that because it knew it was foreign. So when they took the stent out, it released the clots that can go to the brain, the heart, other places, and went to
An
his
emboli.
feet. It went to his feet, and nobody knew that he wasn't getting circulation, and his feet were black. By the time they found him, from the knee down, he had to get his feet amputated. He was a very, very active man. He was active up until his surgery. But once he woke up with no feet, he was like done.
So
If somebody had been doing their job and checking better, and it hadn't been 3 or 4 days before somebody looked at his feet, he would have not had that issue. So I just wanted to say, if you're gonna go into that, make sure you're checking someone's feet. They're in the socks and in that chin.
So, more than the socks, Valencia, what do they call those contraptions?
Tag
with-
hoses.
Huh?
You talking about tag hoses?
No, not tag. But the little contraption they put on and it massages the tissue.
Sequential compression garments.
Thank you very much. So,
I hate those things.
but they work. And so they even have those these days that can help with that kind of.
They put that on, but under, or on, over top of a sock, so you couldn't see, and the only way you would be able to
Like,
see.
dude, if you're gonna be a nurse, like, really know that you really have to pay attention to these people. It's not a check. Don't go in there just trying to get a check.
Yeah.
People are gonna die on your watch, and it's gonna eat at your conscience eventually, and you'll be trying to do something else. You
So-
have to really care for these people.
When I had my shoulder replaced, the people would come in and they would take blood pressure and temperature all the time. One time, my blood pressure, according to them, registered 80/40. And I would always ask him, well, what did you get as a reading? He said 80/40, and he just wrote it down. I'm like, are you gonna take my blood pressure the old-fashioned way? It doesn't appear that your device is working right. Oh no, that's the reading. I gotta write it down. I'm like, oh my God. I said, I'm dead. He didn't get that I was criticizing him. I am not a good patient. I know too much.
But I feel like sometimes it comes in handy for that.
Well, it can, except this young man was either not trained properly or he didn't care about what he was doing. Because if I would have got an 80/40, I would have said, oh hell no, this is not right. And I would have done it some other way. It's scary to me that a lot of people do not know how to take a blood pressure.
Yeah, because when the power goes out, what the hell are you gonna do?
So, did I tell you the story? Monday, I showed up to the South Austin campus. No, it was yesterday, Wednesday. Showed up at South Austin campus. Electricity's out.
That happened here too, though, in this.
That was Monday.
Monday.
Right. So Monday, I just moved my class to Building G. Over there is no other building. So the people who met me at the door said, the electricity, I can tell. So what are you gonna do? I'm like, I gotta go have class. Well, how are you gonna have class? I'm like, I'm gonna old school it. I wrote on the board, When you have somebody who knows the material, it didn't make a difference. This is a crutch for me. I have it there, but I like to just talk about stuff, right? I don't read off of there. So I don't need to have this. And I gave a lecture on homeostasis, both positive and negative feedback loops, and systems of the body.
No, that's like the easiest thing to.
Luckily for me.
Yeah. If the power's out.
Because if it would have been transcription translation, I think it
Oh,
would have
yeah.
been different.
Yeah.
The students have got,
Hours just writing on the board.
it's amazing, right?
I will say that a lot of the stuff, even, like, I'm not going into nursing, but a
Maybe
lot
you
of
should.
this. No, I don't want to. A lot of this stuff should be taught more to everybody. Because, like, my mother-in-law she was in nursing school, only had like 2 months to finish, and she has had a sign from God that like she needed to do something else, so she did. But she has a lot of knowledge. My mom's a nurse as well, so like I have a lot of background on it, and I know some things like something happened during my labor that shouldn't have, and I caught it because I told them like that's not right, But also my husband's uncle, very mistreated medically. He had a bed sore on his back.
Bad nursing.
It was awful. It started to go gangrene. I'm not joking, like it was terrible. My mother-in-law saw it, noticed the signs of it starting to go, and it's eventually what killed him, but he would have died a lot sooner if she wouldn't have seen it because of the negligence in nursing homes. It's a serious,
And it's not
issue
all
now.
people, but
No,
there are
no.
some.
But
And
a
there are
lot-
enough.
It's
I mean, you
just
hear
like-
those stories where, I don't know, like, this whole nursing, like in Austin, like a year ago, this whole nursing assisted living area just got shut down because there was such bad non-compliance to their patient population.
Well,
And so
that's
it's
what
important.
happens. I don't feel like the state does their rounds as much anymore.
Yeah.
Like my mom, I remember when she would be like stressed out, she was like, oh, the state's gonna be there, and it was a lot. It was like once every 2 or 3 months. And now, like she
It's
actually.
once every 3 to
It's
4
every-
years.
Yes.
No, they come every 3 months, sorry.
Oh, do they really?
Some of them they do.
They
some
come in
of
like a
them-
whole gang and just run through the whole building, like
They-
looking for stuff.
Those are they come to the
Yeah.
pharma plants too, right?
Yeah, they come through like that.
I know that's a big reason why
Where's
there's
this
so
format?
much negligence in dental, because they do not.
No, like really, we got written
do
up because
that.
somebody didn't have a floor mat on the floor. Because some idiot put a mattress on the floor instead of a floor mat.
They're very,
Yeah.
state is serious.
What? They look for everything. You can't leave any materials in their room, no feedings, no, like, nothing can be in the room, everything has to be clean, all sheets need to be clean, no debris, nothing in the trash can, like, we keep everything tight in our
It
building
is-
for the most part, but, like, other places, it's absolute hell, so I know what she's talking about. Like, don't send, okay, if you have family here in Austin and they're getting old, do not send them to Hearthstone.
Yeah,
Okay?
that's what I'm worried
Jesus,
heard
don't,
about
don't
that.
send them to Hearthstone.
So it's really great to have people who are professionals already in, so that you can hear their stories. Because again, it is a calling, and you're going to see some things that you might not really want to see, right? It's important. And I know my dental hygienists feel like I just simply don't include them.
No, it's the
Oh,
same thing.
No, hold on,
I
hold on,
can
hold on.
It's the same
say
But
thing.
hold
I
on.
don't have that.
But listen, my whole lecture on gastrointestinal, there's a big section in there for dental hygiene.
No, but this pertains
Right.
to it too.
Yeah.
Because, I mean, we have to keep an eye on this stuff because, like, if a patient came in with that stuff and we saw it and didn't do anything about it, we can be held liable for that kind of stuff. Like, if they died because we took a tooth out and they already had gangrene, it can spread like that.
Well, even
Like, you
older
have to pay
individuals with
attention.
dental hygiene, a lot of times with older individuals, you give them a prophylactic antibiotic, right? Before you even do anything.
It just depends on, like, knee replacements and stuff like that. But now, do you know how lenient they are about that stuff now?
Well, I know,
when-
some do it and some don't, right? That's all I know.
Yes, it depends on that, like, I always get like a medical referral, I mean, not a referral, yes, thank you, and, a lot of, like, doctors don't even care anymore, they're like, oh, 6 months, if it's after 6 months, you don't need the antibiotic or the prophylaxis anymore.
I just
And
have
used
to
to be, it was
say,
like 5
I
years.
am not going into nursing because I can't see blood, and like this is like very uncomfortable.
Wait, aren't you gonna see blood in people's mouths?
Yeah, but like that's like
Different.
flossing, you know, like that's okay. Like, but if someone's like panicked, I would be not able to help them because I would be too panicked. So like, I appreciate.
Well,
all
it's
the
really,
services.
that's another thing, it's really good to understand your personal limitations, right?
Totally,
I
that's
think
my
I told you the
limitation, I
story,
can't do it.
But that's why
my
the
study
doctors
group
there
in
too.
college were a lot of really
There's more
smart
people.
chemists, and they said, take P-Chem, and I said, hell no, I know that I can't do that, why would I do that? You know, physical chemistry. It's a combination of calculus and chemistry together.
Ugh.
No thanks. So here you can see the gassy, it's called gas gangrene because there's so much gas that's being produced by these these anaerobic organisms that the gases kind of sequester right underneath the skin and they form these bulbulous areas. And these bulbulous areas are formed by the gas and the serous sanguineous secretions. Here you can see was a debride. When they debrided this, they were trying to save the foot, so they removed all the necrotic tissue. Then they put them into a hyperbaric chamber, which what Samantha said. And that's true. We have hyperbaric chambers or hyperbaric utensils or utility devices that will be small enough for a arm or a foot. We also have, you can put them the entire person in there. A lot of people can't handle it because they're claustrophobic. But nowadays we have hyperbaric rooms, and we can send them into this room. Yes?
You have to be careful though, because people could get oxygen concentrates.
Yeah, but that's a really rare thing. And so, oh, it did? So, you know, the entertainment industry started to produce these hyperbaric bars.
Oh, I've heard of those.
They
pump
were a big thing for a little while.
oxygen?
Yeah, they would feed pure oxygen
Oh,
in, and then
oxygen
when you were drinking alcohol,
Don't they
You
have
would
those
get-
in Vegas?
Oxygen
They-
bars.
well,
They have
all the casinos
have, yeah,
all are hyperbaric
yeah.
because
Makes you stay like
it
longer.
makes you
What is it?
euphoric. And if you're euphoric, you're more apt to spend a little money on the slot machine.
Yeah.
Is that why it feels like that, like in the building?
In Vegas.
It's just happy, right? There's happy juice.
It
That's what it
feels
is.
so weird.
Yeah.
I've never been in a casino.
It just feels like cigars.
So my,
You can smoke inside.
You can go visit
You
my
can do
aunt and my
anything.
brother. They go all the
I'll go
time
casino
now.
hopping with them. I've never been, when I turned 21, I was pregnant, so.
Yeah.
I never went.
Yersinia pestis. Lay. Right. So plague happens in 3 different ways. It shows up 3 different ways. It becomes pneumonic, which is the most severe, which most people think it's bubonic, but pneumonic can kill you real easy. Pneumonic is the lungs, septicemic is blood, and bubonic moves into the lymphatic system, which then can actually affect the lymph nodes. This is the way a physician used to dress. You should know that if you see this type of uniform, that it is a physician who was dealing with plague patients. So he had this leather, it's more rubberish kind of thing, these gloves, and then he had this little thing that you could poke at people to see if they were alive, and look for the buboes or the necrotic tissue that was associated with Black Death. And so he would have this face mask, which I'm still, in search of one, if you find one. I want the old ones made out of wood, balsa usually, but I don't want the ones that are plastic. Those things are on eBay everywhere. They're just for costume. I want an old one. If you see an old one, call me. I'm gonna go and buy it because I want one of those.
What's his name? And the show called Sandman, he wears one.
Oh,
Which
yeah.
one? Oh, yeah, yeah.
Sandman, he wears one.
Yeah.
Look in New Orleans.
My brother is there. He said, I found one, $5,000. I said, sorry, I got pass. What am I gonna do with it, Sam? I'm gonna bring it to class and show it to people.
Oh.
You're gonna scare the neighborhood kids.
Yeah, so this weekend, my wife and I went treasure hunting to McGregor, Texas, which is just up a little bit from Bell County. And I found an old skull, a prehistoric skull of an Oreodont. And I was talking to the lady who owned it.
What's that?
Oh, it's like a little pig-looking thing that is more, it's more related to a camel than anything else. So I found this, I was talking to a lady about it, and she was very impressed at my knowledge on, all these organisms. And she said, my husband bought that years ago, and he paid a lot of money for it. It's been sitting there for 20 years. Do you want it? I'm like, well, I might. And how much is it? Well, she said, I'll sell it to you for $40. I'm like, okay, I'll buy it. But then I felt guilty, so I bought a lot of other stuff there while I was there, because I also love Asian art, and she had a lot of it, and I bought a whole bunch of it, because that's what I like. And my wife said, you spent that much money off of what? And I said, look at the skull. How much did you pay for that skull? I said, $40. She said, what's all this other stuff you bought? I'm like, and I told her, I bought all kinds of cool stuff.
She's gonna go home and tell her husband that she sold that for $40.
Her husband passed.
Oh.
That's probably why she sold it, because he probably would have not let it.
Yeah, I was
sold.
like, you're gonna be in the doghouse.
I have it in my vehicle. If anybody wants to see it, I can go get it.
You should bring it.
Bring it for the potluck.
I'll bring it to
Yes.
potluck. It's gonna be in my office, but because I was locked out of my office on Monday, I couldn't get in, so.
Just leave it in your vehicle.
Okay, so pneumonic is lungs, septicemic is blood, and then bubonic.
Lymphatic. I'm gonna show you the difference in just a minute. So first of all, for the exami-poo, you should know that the etiology for plague is Yersinia pestis. It is an enteric. It is more closely related to E. coli than it is to any other bacteria. Isn't that scary?
What is it? What is the etiology?
Well,
Yersinia.
Yersinia pestis. That's right here. L.
Oh, okay, sorry.
Okay. So here are the two things that are really important, the flea and the rat. Now, squirrels and other things can be involved also, but the flea seems to be the primary vector. It takes a blood meal from a squirrel or a rat who has Yersinia pestis in its blood, and then it bites a human and it can spread it. Now, we in Texas have about 2 cases of Yersinia pestis on an annual basis. And it's west of I-35, not been a case east of I-35 in a long, long time. But west of I-35, we have 1 or 2 cases. The closest case that has ever happened since I've been around this part is in Winterland, Texas. But most of them are in West Texas. Okay? So it's pretty cool to think about. Now, the pneumonic plague is much worse because just coughing, you can spread it. But the bubonic and septicemic plague are much more dramatic because the body looks really weird. Here's some of the buboes that can start to form. The buboes, they're called buboes. You should know that. This is a nice symptom that shows up for bubonic plague, buboes. And then just the enlargement of the lymph nodes, they get to be about the size of a small tangerine, right? And so they get pretty large. Now, they're hard to see here, but I'll show them to you in just a minute. Treatment.
Wait, did you say enlargement?
Buboes. It's on the slide 13 under the symptoms. It's the swollen lymph glands called buboes.
Oh.
Thank you, sorry.
So treatment is usually a multi-antibiotic regimen. And it usually is some of these drugs we almost never see, right? Streptomycin, chloramphenicol, those kind of things. But we give multiple different antibiotics to treat, because it's got so many virulence factors that we just have to treat that this way. So here are, if we think about it, it's called Black Death because of the necrosis that happened. Here you can see are the buboes, right? So this is the way bubo is spelled, but it can also have an E-O at the end, Miss Jen. Okay? Bubo, but it can have an E-O. And here's a lingual bubo right here. Here you can see the gangrenous tissues that are associated with the hands. Right? Now, bubonic plague in itself, pneumonic plague, septicemic plague, it's treatable, but you gotta catch it early enough. If you catch it early enough and treat, the mortality rate is like 5%. But if you don't and it gets out of control, then it can get really crazy. And although, you know, the stories of bubonic plague, you know, in the Middle Ages really have talked about a lot of death associated, and that is true. But really, we're more worried about it in our recent history about pneumonic plague because that can be really transferred very easily. Yes, ma'am?
What's the incubation time?
It's variable. So for somebody, it might be as short as just a few days, or it could be a little bit longer. There was a case that happened from an individual who was in California and was touching squirrels, and one of the squirrels had it, and it somehow or another got into him. He was flying on an airplane, and then he was coughing and potentially exposing people on the airplane. And when they found out that he potentially had plague, they sequestered everybody on the airplane for 2 weeks to make sure that they didn't have it. Now, he survived because he got treatment for antibiotics, and he was already on an antibiotic when he got on the plane, but it got worse as he was on the plane.
So this is an example of the septicemic and
Black Death.
Mhm.
Okay. So this thing has been around, Yersinia pestis has been around a long time. And so it is in our folklore everywhere, right? Some people wrote about Ring Around the Rosies, right? So Samantha and some other folks. Some people wrote about different pieces of art that really have related to it. But it's everywhere, right? And you know, the Pied Piper of Hamelin was all about play. People didn't know that. Now, it's got a very different twist, because when the Pied Piper didn't get paid by the magistrate, he got mad and he mesmerized all the kids and took all the kids, and then, you know, something bad happened, right? But it's just amazing how it started with the idea that you could take, if you take the rats out of the city, you can get rid of plague, and that's true. And right now, if we think about it, does anybody know about the rat population in New York?
Oh, out of control.
Oh my God, yeah. There are two big colonies of rats, the eastern rat and the western rat, and they do not intermix. And it's just crazy. And there are millions of rats in those
Yeah, I was
colonies.
thinking.
It's crazy.
A whole book called
I
Rats.
didn't see any
All about that.
in I was hoping to see that.
So they live amongst the
Your New
mole
York
people.
bucket list brings
I went to New York City
Yeah,
one
right.
time.
Yeah.
Heard of that?
I don't know that's true about the mole people, but I do know that the rats are true.
There's a whole book about it if you wanted to go down that mole hole.
But is it, but,
I mean,
that
it
was cute.
Pretty interesting.
But is it folklore or is it real?
It seems very, very real. There's a person that goes down and like hangs out with the people that live underneath the ground, like. you
I
know?
just can't
Like Ninja
believe,
Turtles.
I just can't believe that that would be a true thing. I mean, I would have to see
They
it for
come out.
myself.
They come out, but it's like a safe haven, it's like, place
In New
here
York
with
City.
all the
Like
tents
Futurama,
in the
New
woods.
York.
Just
You know,
like
they
there's
go
almost-
underground.
Yeah.
Well, there's a dock on it.
It's just like almost people living underground.
Oh,
It is.
I just can't believe that they could live in the sewer system very long, especially with all the flooding that happens in that
There's
sewer
always
system.
up and down,
Yeah, there's
travel
people that
spots.
live there.
They're
That's
not
true, the
clean
flooding,
or anything.
absolutely. I guess they lost a few.
So guys, I'm not saying that I don't believe you, I'm just saying I'm having a hard time accepting it. I'm gonna have to go
There's
and
also
see.
documentaries, so they go down there, they're camping essentially, setting up the little favelas down inside the subways.
I'm not saying I don't, I'm just saying I'm
Have
having
you
a
been in New
hard
York
time.
City?
Never been in New York
Oh,
City.
no.
Oh.
You know, you see the pictures, like it's all pretty and cute. No. We went during Christmas time, the snow was black, literally black, and it was disgusting. There was like a smell to it, and it was so nasty.
Well, so that reminds me of
I
Los
never wanna go
Angeles.
back.
That reminds me of Los Angeles. I remember being excited about going to a nerd conference in
so
Los
nasty.
Angeles, and when I got there, I was so disappointed.
Cause it was disgusting, right?
It was smoggy, it was nasty. I went to the Chinese theater to check it out. It was so tiny, I was like, this is what people are talking about.
You're gonna have a good time. You go in the spring or the fall. and
But
you
the
go
food was really good.
Mhm.
I can't say the food.
See, that's the only reason I go back to New York City is for like the food there and the arts. I wanna go to Broadway.
This is an oil.
I wanna go to Broadway really bad.
I couldn't believe it. I was in one of the Smithsonian. I was looking at it. I was gonna take a picture of it. I clicked, didn't get a good picture, Tram. I'm not as good as you are. The docent yelled at me and said, if you take another picture, you will not be allowed to come back to any of the Smithsonian. I'm like, okay, fine, I'm not gonna take a picture. So this is one that I found on the web, and it's really quite interesting. You can see the blue bow. But I just couldn't believe, I got so close to that painting, I could not believe it was an oil. It looked like a photograph.
You need to look at the guy on TikTok who does it with pencil. His drawings with pencil, like you would think the person was standing right in front of you. Some people are just
There's a
amazingly.
couple
Yes.
like that.
I know the guy, but I don't know his name.
Let's talk about Lyme disease. So Lyme disease is a very complicated infection. So, the etiology for Lyme disease is Borrelia burgdorferi. And this has been called lots of different things, right? Yuppie disease, all kinds of stuff, right?
Yuppie disease? What is that?
Because it was affecting a lot of young people. Because the organism gets transmitted to a human by the bite of a tick. So there are ticks in Texas, right? Bastrop. I don't know about Luling or
They're
Lockhart.
really not that bad on our property.
Mostly because of the fire ants. So if you've got fire ants, you don't have ticks. I went to Arkansas.
Oh, really?
Arkansas is one of the most beautiful states I've ever been to. I could not believe how beautiful this place was. We were walking in the woods, my wife and I, and our little dog Peppy, which you've seen, died. But we were walking in the woods, and we got back, she had a tick on her arm, and we pulled it off, but then we found that we had more ticks on us. And then we noticed Peppy was itching. He had over 30 ticks on him. The little guy was stressed out because he had so many ticks, and so we pulled him out. So he didn't go in the woods anymore with us, right? But that forest is just gorgeous.
I had a spray tan when I was like 16 and I had one on my shoulder and I literally went to the bathroom throat. It was so nasty. Cause you have to pull it. We always pull it. It's a clockwise, counterclockwise.
Oh no,
to
the
pop
only
them
way
off.
to truly pull them is to grab them at the bottom of the proboscis and pull up on it.
Well,
If you do it any other way, the proboscis, where's my buddy? The hypostome can actually, I see that. Right, weren't you the one that asked about it? Yeah. So it can get stuck in there, and if it gets stuck in there, you can get a lot of other infections. And so it's really interesting.
We've always
Buc-ee's
rotated.
Buc-ee's has this little thing that looks like a little hook, and you can buy it, and you can put it on there, and it pulls it right out. It works really great. But they want like $20 for it. You can get it on Amazon for $8. So if you're gonna go buy those.
Ticks are disgusting to me. I treat my dogs and the cattle get treated with
Ivermectin.
I have a question.
Yep.
So my doctor got me not too long ago, didn't do a very good job, a little bit of it's left over. Do I need to be worried?
Probably not.
What is it?
I mean, it got a little crusty because we were punching the heck out of that
By,
little area.
Oh, the dog.
The dog,
Matt.
but.
by
he
this
still loves
point,
us.
by this point, the immune system has moved on in and taken care of business, so.
Is it eventually gonna be pushed out?
Or
Absorb.
absorbed.
Or absorb.
So here are the two symptoms that you need to remember for the exam poop. If you see Bell's palsy and erythema migrans, those are very indicative together of having Lyme disease. Separate, they're not. Because Bell's palsy, facial neuropathy, cranial, I think it's cranial nerve number 7. You can get Bell's palsy for lots of things, right? Cerebrovascular, it could be multiple sclerosis, it could be lots of things, right? But that, along with this bullseye rash erythema migrans, points to Lyme disease. Now, Lyme disease itself is treatable, but in order to treat it, you have to use a long-term regimen of antibiotics, sometimes over a year, right?
What did you call the rash?
Erythema migrans, bullseye rash. So there are lots of different reservoirs, mice, squirrels, other small. In Texas, it's the deer. It's just the deer. They have them all over the place, right? And so it's really interesting. My wife's family bought a pony at auction for one of my nieces who loves to ride horses. I don't know how this pony got in the auction in the first place. It was full of ticks and turkey lice. And my niece had hair longer than Tramp's. It was beautiful hair. And she got on this pony, and you could see the turkey lice come off the pony and crawl up her body into her hair. And they were everywhere. And so she was screaming because she had all this stuff on her. And the only way that they could solve the problem was to cut her hair off.
No.
I would have been fine with it. Shave it.
So the father said, the mom cried, my sister-in-law cried, but the father said it's the only way. There's
Well,
really
who
nothing.
like talks about how those people can't own horses anymore? Like, do those people get to have horses?
I don't know. It was whoever they got the auction to. The auction should have never accepted the animal.
And also, if they tried to have it there, this is animal abuse.
How long ago was that?
6, 7 years.
Why did she get on the police?
Why did she get on? Because she was happy she got a pony and she just jumped on it.
I will say that it was only like 2 or 3 years ago that they started implementing training for some of the people that work at these auctions to be able to look for things like that. I know some of the older generation had that training beforehand, just knew it was common sense, but it didn't turn into that anymore. Like the newer people that were coming in didn't know to look for things. Because I know in Lockhart, all those people just went through another class because they got like, after so many new employees, they do the training again. So it wasn't like a big thing back then.
Well, I mean, so I'm probably, if that side of the family looks at me, I'm the city slicker. All right, are you with me?
Well, now you can tell them.
They're all country, right? But and my wife is, more like me than them. So we're the city slicker, or they call us other things.
I know some of the bigger auctions actually like will hire a veterinarian to come the day that they're
Yeah.
accepting animals, but it's hard to afford it. Because not many people care about the auctions anymore. One in Lockhart is huge again, because everybody's.
So it's a good
selling
way
them.
to get things sold, right? So here you can see is a map where a lot of the clustering, is that moving or is it just me?
It's moving.
So here you can see a lot of the clustering of the infectious agents. Now, you can see they're in Texas also, right? And of course, Arkansas and
It's
Oklahoma. Right? This whole portion of Oklahoma is all tribal area, a big part of it, right? And so it's really interesting to think about how that happens. But if you notice the kind of the area here in the Four Corners, there's not very much there at all. It's just too dry. Right? And so it's interesting to think about how that
The
happens.
cold up there wouldn't really
Well,
be
so
a factor?
I don't know why there wasn't any data from Wyoming or Montana or places like that.
I feel like it's humidity.
I don't know. I mean,
Well,
why
think of it
wouldn't
as
there be
Florida.
ticks up there?
Well,
right?
when I first moved to Texas and my cat got fleas and I'd never known what fleas were, like to look for them, and my mom was like, you need to call your aunt in Seattle because they get fleas and ticks up there because of the humidity, like because of the weather. And I feel like that makes sense on the West Coast too, kind of.
Oh, you mean like it makes it
The West-
worse?
It's not humid, like not.
Population centers and trees.
What is Sarah saying?
She said it's not humid in
I
California.
mean, there's some, but it's.
Yeah, it's not,
very, very
I can remember
extreme.
being in San Francisco and it was
Oh, yeah.
dry, but it
I've
sprinkled
lived-
all the time, right?
I've lived throughout California and Oregon, but it's not necessarily humid, but it rains more than it would rain in Arizona. is
Well,
what
it
I'm
definitely
saying.
rains more in the Seattle area than any
Oh, yeah,
place else.
totally.
You gotta have people that have cases of Lyme disease.
Yeah, that's true. But there are people there, I mean,
Yeah.
there are people in Arizona, right, and all kinds of places, right?
You know, we talked about the, poverty rates. This kind of looks similar to those poverty charts that we looked at with like the infections and stuff.
So you're
Maybe like
making the
homeless.
link, well, except, there's a lot of really wealthy people in Arizona. You know?
Yes, but there's a lot of homeless people in New York and California and Florida and,
That's a
But
good
those
point.
are
You know
only
what I mean?
set to certain.
Why is there nothing going on in West Virginia?
It's not
Yeah,
everywhere, like.
there might not
more
be any,
likely to
there
be
may
in
not
the
be,
valley.
they may not be reporting
They ain't
anything.
reporting.
Yeah, that's it. That's just,
Right.
that's just
They
Tuesday.
just don't like anyone.
Yeah.
Cities, yes.
We don't know. You're only as good as the data, so it's just kind of interesting.
I don't know, it just kind of looks similar to that poverty map, like a homeless rate or something.
So I will tell you that there is 2 schools of thought for treatment. The American Medical Association has published basically saying that use antibiotics, but only use them for a short period of time. There are 3 experts on Lyme disease. One of them lives in the Northeast, 2 of them live up there, and one of them I think lives in Dallas. And they basically say the only way to get rid of Lyme disease is to use a long course of antibiotics for over a year. Because the organism gets deep-seated in into the tissues and hard to get rid of. Okay? What's that?
Why would you do that?
But,
That's like asking to die. Why would you?
well, I know, very toxic, right? But the problem with that, Valencia, is that people who report or have been diagnosed with Lyme disease are in pain. It's painful to them, they can't think straight, they can't move, they have headaches, they can't breathe, all kinds of craziness.
Okay, so in Texas, the reservoir is the deer and then the carrier is
That's the big
tick.
one. And the vector.
Vector.
The vector is the tick. Okay? All right, brucella. This is undulant fever. You can see the 3 different species, Brucella melitensis, Brucella abortus, and Brucella suis. These cause undulant fever. Undulant fever is important because in a little town not too far away from here, there was a big outbreak several years back. And undulant fever really affects the tissues of the body, lots of them. And it's called undulant fever because the fever comes in waves. During the day, you're like normal, but at night, you get this spiking fever. And so that's why it's called undulant fever. So you can see some of the edema that happens, some of the swelling that happens can really affect the bones itself. But if you look at all the symptomology, similar to flu, you have all kinds of problems, except for the fever. The fever shows up early, and that's part of the question that should be asked, and if you say, have you been running a temperature, and they say it's really weird, I have a high temperature at night, but a normal temperature during the day, you should suspect something rare like brucella. Right, now brucella itself can be problematic, and you can see that the CDC has reported that most of the individuals who picked up infections of brucella are like butchers. But now, these aren't butchers at HEB, these are butchers that are gonna be in these little mom and pop stores that might take in wild game and process the wild game for the individuals, right? Meat packers, you can see that ranchers and hunters, and then 10% of the individuals who acquired brucella infections consumed unprocessed, unpasteurized dairy products. Now, I am a big cheese lover, and I do like to eat artisan cheeses. I understand the challenges there, right? But I'm willing to take that chance because I like the cheese. Not everybody wants.
What's an artisan
Do it.
cheese? Like, what's an example?
Anything that's made by somebody and not necessarily a company.
If you ever go out to Schulenburg, there's a dairy out there, and they have this, like, I don't even know what it is. It doesn't have a label on it. They just, it's all
Cream, heavy cream, right?
no, it's like a trust system. So it just says this weight of cheese, this much, whatever. It doesn't even have a label, but it's just like, it looks like a cheddar and it has like peppercorn in it. Oh my God, it's so good. But that's the kind of cheese, like somebody
Yeah,
makes it.
like a.
So
okay.
the closest place that you can find artisan here is either at a farmer's market or at Antonelli's.
Oh, I've never been there.
But
Somewhere like-
Antonelli's,
They've got a commercial.
Antonelli's
What's
is gonna be
Antonelli's?
different because they are very high-end, and they're gonna buy their stuff from very reputable people, so.
What is that thing?
It's like a
Antonelli's,
local
it's in
Austin
Hyde
shop.
Park,
Uh-huh.
but it is,
Oh, that's what you had to say.
They have a Capital One commercial.
They
Oh,
do.
they did.
Oh.
Yeah.
very,
Yeah, like,
very,
somewhere like-
very high-end. A little chunk of cheese this big costs you $24.
Somewhere like
gosh.
Whole Foods wouldn't have like unpasteurized.
But they're
dairy.
gonna
The
kinda
best life
get
of your life.
very high-end
quality. It wouldn't be like a mom and pop place making.
So you
cheese
know,
off their old
you
town.
go to a farmer's market, you can get really good quality stuff, but every once in a while something happens, right? So you just gotta be careful. So I wanted to talk about blood cultures real quick. So blood cultures, I think it's important for nursing students to know, and I don't know if it's on my HESI or not. It would be something that I would ask if I was writing the HESI.
Yes, what is
Like,
it?
the question that I would ask,
Was this on it?
the question that I would ask is, how many days does a blood culture have to run before we can call it negative, and that's 14 days.
No, the A&P section on that test was a total joke. It was like
It was,
5
like, really
questions,
basic,
and it
right?
was the most basic stuff I have ever looked at in my life. And I was like, in the bag, baby! And the rest of the stuff, I was like, whoa, I haven't seen this since seventh grade.
So blood cultures are done.
Was the HESI test.
They're done in tandem. One of the blood cultures is done aerobically in TSB, you've used that before, right, tryptic soy blood. And the other one is done anaerobically in thioglycolate, and you've done that before. And so what we're looking for are those organisms that take a little bit of time to show up. They can show up as quick as 4 hours, but they might take up to 12 days. And so when we are running blood cultures, and some of you, if you work in a rural type of area, you might be running blood cultures, right? Because when you work in those smaller communities, you do a lot more, okay?
So can you say that, repeat that one more time? So you have to look at it within 14 days, otherwise?
Every day for
Every-
14 days.
Oh, every day.
Mhm. Yep. And it's only after the 14th day that you can call it negative. So if we look here, you can see that brucella can be very deadly, but if we implement antibiotic therapy, which is usually doxycycline or rifampin, right, that really the mortality rate goes below 2%. And it's usually those individuals who develop endocarditis, right, affect the heart. Okay?
Do we need to know about like the aerobic?
No,
Okay,
I just wanted you all to have heard it here before you go to your nursing program and they start talking about blood cultures, you'll at least have heard it.
I'm gonna need you to repeat that.
You want me to repeat it?
No, I just said if we needed to know.
So, tularemia, Francisella tularensis. This is a BSL-3 bug. So I'm going to tell you on the exam-poo, there is going to be a question that's going to ask, based on how easily something is communicated, there are two organisms that are very contagious. Those are going to be Francisella and the other one is Shigella. 10 cells is all you need for those guys. Or Shigella, you know, it might knock you for a loop, but you mostly won't die from it. This one you can die.
Die
Okay.
from the 10 cells?
This one, not Shigella, this one, okay? So here you can see Francisella itself causes tularemia, also known as rabbit fever. And so you can see that the organism itself can survive in very weird conditions. Moist soil, detritus, in a carcass for a long period of time.
Kirby, you said known as rabbit.
Rabbit fever. Yes,
For the exam, do we need to know genus and species or just genus?
genus and species. But remember, Jin, it's multiple choice.
Oh, yeah, that's right.
So you're gonna see it there, you're just gonna get to pick it. So if you might see something like, this particular etiology is also known as rabbit fever. Which of these organisms represent that? There's like a few of them. Right. Good? So here it's called rabbit fever because that's where it was first identified from. Although there are many organisms, right? Voles, mice, water rats, squirrels, all kinds of things that can
What the hell's a water rat?
I was just thinking that.
A water rat is a rat that lives in the water.
They're in like
They're all over the place. They're here.
You've
Yeah.
never seen them before?
No.
They're fairly cute.
Oh, I'm pulling it up right now.
I
y'all.
thought one of those things rodents are.
Oh, it looks
cute.
kind of like a beaver.
I don't think it's
almost.
cute.
It's not my thing.
They're
Yeah.
Oh, little
They're
snap.
like black and they're cute. They're like the size of like a
Okay, I've never seen somebody get so excited over a water
But
rat.
they're not.
Which picture do you have?
All of them.
They're they will chase you.
Sometimes
They're
referred to
in,
as a nutria.
what?
It is a little different, but
Yes,
they're sometimes
nutria.
confused.
Okay.
Okay?
It's
So-
a nuferat. That's like
The
not
nutria
cute
is
wet.
the other thing that people think they're the same. There's a little bit
Nothing
different.
looks like
It looks
beaver
like
a little bit.
yeah, they're huge.
But that was
They're like
really-
the size of a small dog.
Like that was really cute, you all. All of a sudden, everybody's what is a water rat?
I lived in Granbury and we had them.
So, the way that you can contract tularemia are real typical, right? So you can get it from direct contact with an infected animal, because a lot of people who hunt will field dress their own animals, and when they field dress their animals, if they cut themselves and the organism is in that carcass, then they can pick it up that way. The other way is, of course, by getting bit by a deer fly or a tick or a flea. So I don't know if you've ever seen a deer fly. They're,
Oh, big, right?
no, that's a horse fly.
Oh.
Now those bite also, but a deer fly is more slender and quicker, and you'll know you got bit by those things because they hurt, right? And so a lot of times you're gonna find them in the woods. You're not gonna find them in your backyard. Okay, they take blood meals. That's the way they do it, right? Or you can ingest animals that are not cooked properly. So it's pretty rare. However, I will tell you that if you eat wild game, I do, my friends give it to me, you should
What?
always make wild game.
Squirrel.
Not squirrel, but not possum. I'm talking deer, javelin, hog, those kinds of things. You should make sure that you cook your meat all the way through. Okay?
I'll burn it.
Now, here you can see there's a focus of infection, and the organism gets in the body and then it becomes systemic, right? And so if I was to look at this, I'm thinking, oh my, it's a gram-negative rod or it's a staph. And I go in there and I check it out and I find out, oh my God, there's something else going on here. And then I look at it and I find them inside of neutrophils, I'm a little bit worried right away. Because this organism likes to be phagocytized. Because when it gets phagocytized, it resists the phagolysosome, and it grows inside of the neutrophil, and then it gets to be so much that the macrophage dies, and then the organisms are released. So you can go from feeling okay 1 hour to another hour later being very, very having a lot of discomfort, high fever, and all kinds of things because of the way this organism replicates. Yes?
It replicates inside the macrophage.
That is correctamundo. Okay? Questions?
Yeah. Can
What's
you
that?
say all that again? It resists phagocytosis.
No, it likes to be phagocytized, because that's when it replicates inside the macrophage.
But it resists the phagolysosome.
Yeah, it doesn't get killed.
So it wants to be in phagocytosis, or it wants to be phagocytized.
Well, I don't know that it wants to, but it does really well once it's phagocytized.
Okay, because
Okay.
it's multiplied inside the macrophage. And what else?
Then it resists phagolysosomes,
Okay.
and it propagates in the cell. Kills the cell becomes apoptic, and then it gets released. What did you say, my brain hurts?
I said so many words.
Oh, I know. Jen loves it. Okay. Cat scratch fever. So the reason I put this in here is almost every semester students would say, what about cat scratch fever? I'm like, it is not a bad bug. I said it's self-limiting. I'm not really worried about it, but they would ask about it, so I just put it in. The etiology for cat scratch fever is Bartonella. So if you get bit or scratched by a kitty, you're probably going to have a little bit of the infectious agent get in. And really, it's self-limiting usually for a person who has a good immune system, that it doesn't really bother you. Sometimes it can become more severe, and then you can treat it with antibiotics and it'll clear it up quickly. Almost nobody has a negative outcome from Bartonella. Okay? Questions?
Why are there so many things trying to kill us?
They're not trying to kill you, that just happens to be part of their life cycle. Okay? Now, what I will tell you is this is the Motor City Madman. The Motor City Madman, Ted Nugent, who is now a big gun-toting conservative, he wrote this song called Cat Scratch Fever.
Cat scratch fever.
That is it. However, it's not about Bartonella. It is about a sexually transmitted infection that he got from the kitty next door. And the kitty next door is not a meow meow. Are you with me? It's a wappa wappa. Are you with me? So you just have to follow the lyrics. I had one individual who wrote about cat scratch fever, and they were just talking about Bartonella and Bartonella. And I'm finally, at the very end, I had to say, I'm really sorry, but you misinterpreted the lyrics. It's not about Bartonella. It is about a sexually transmitted infection. Right? So it is a cool song, but Ted Nugent was full of innuendo. All of his songs, I mean, just look at some of the titles of the song, all right? And don't say them out loud, Eric, when you see them, right?
I gotta see it.
But he's an amazing artist back then. He was the first concert I went to, Tramp, right, in the early 80s. First concert I went to with my cousin, who was a very conservative young lady. I don't think she knew what we were getting into. She was older than I was, and she paid for my ticket. We went, and then he started cussing and all this stuff, and she was completely, and she said, there's a lot of people smoking marijuana here. I'm like, it's a concert. Had no idea, right? So, but anyway. Any questions about Bartonella? Okay. Which brings us to Chagas disease. And so we're getting close to the end of this lecture. I want you to know about Chagas disease because it's going to be a big thing. It's already in Texas. It's already in the southwestern states. But we're going to see a lot more of it. And so I want you to know that Chagas disease, the etiology for it is, of course, Trypanosoma cruzi. I want you to know that in some time period, it's going to cause maybe cardiomyopathy or maybe some digestive abnormalities. I want you to know that. And I want you to know that the vector for it is the retrovirus or the kissing bug. Yes, ma'am?
Do you think that we can look at the reaction that dogs have to this and relate it to what we are eventually gonna have to it?
Yes. And it's very sad to see how the dogs,
I mean, because within hours, it's bad.
well, it's not gonna kill us in hours, but
No, but
it's gonna
yes,
affect
no,
us.
a kissing bug, if a dog gets bit by one, they can die within hours. It's extremely serious.
So we do have the ability to treat it, and it's treated with benzodiazole. It's something that's related to metronidazole. You do not need to know that I just want you to know etiology and vector, okay?
Just for
For Chagas.
Chagas, but like everyone else, like symptoms, treatment, everything.
Some of them, the ones that were really prominent, so for like necrotic tissue, for gangrene, those kinds of things I'll harp on, but not here. There's not really anything. Strawberry cervix for trichomonas, we'll talk about it on Tuesday, okay? Yeah, I just think that'll be it, okay? Remember, it's multiple choice, everything's in front of you, you just gotta pick the right one, okay? All right, the last organism we'll talk about today is Toxoplasma. So Toxoplasma gondii, right, causes toxoplasmosis, really can infect every single tissue of the body. And although it has the ability to infect every single tissue of the body, we tend to really focus in on pregnant females and the very rare instances where it can cause an abortion. And that's where all of the resources are put in. So what I will tell you is there are lots of ways to pick up this thing. And if this entire class was to be tested for a titer against Toxoplasma, I think every one of us would test positive. Because the two most common reservoirs are the bird and the rat, right? Now, and then of course,
Cat.
the cat, right? But it's really interesting because when the cat attacks a bird or a rat, it's because that rat gets emboldened and it wants to challenge the cat, and the cat's like, okay, you're gonna die. And then, a lot of times cats won't even eat what they sport on. They just kill them. And then we'll carry them around till they find out that they don't move anymore, and then they just forget about it.
Right, half of them and then leave the other half
They,
for me.
they say that's like a spiritual thing, like that means they love
Oh,
you.
we
Yeah,
lose.
I always am like, thank you.
I wish they
for
would.
being
I
there.
wish they would focus in on the rat and mice population and leave the birds alone. We lose about 1 billion birds a year to cats. So I know that like I think I told you, the cats. My wife, they've adopted my wife. Oh my God. So there are 2 cats. Charlotte lives in the living room, and she was a feral cat, and now Charlotte is a couch.
Living the dream.
She's a couch cat.
She moved up.
Oh.
It's like Pretty Woman.
Even to the point where
Revive
the
the
doors get left wide open and Charlotte won't go outside anymore. Okay? The other one, Misty, was down, she was
Yeah, Pretty Woman.
she was down the street, 2 houses down.
Oh, you stole her.
No.
You adopted
Both
her.
of the folks died.
Oh,
And Misty was neglected for a long time. So Misty came over, and one day I saw her on my wife's lap, and I'm like, oh my God, we're in trouble. So Misty now has moved into our bedroom, and that's where Misty lives. Now Misty is a lot more weird cat. So she doesn't like to get wet, nor does she like cold. So in the morning when my wife lets her out, Misty pokes her head out, and if it's raining, she won't go out. She'll go out, and if it's cold, she'll come back in. But if it's warm and dry, Misty is gone for the whole day, and we don't know where she goes.
She sounds like my cat.
That's what you call a fancy cat, okay?
And then she shows up at about sunset and paws on the door to be let in. Where Charlotte lived, on beetles, because we saw her, we got her eating beetles, because that's what she was eating for a long time. And now she's on the couch. Leave me alone. I'm here. And that's it. But if you think about these kitties, right? Almost all the Toxoplasma cases are really related to food preparation, improperly cooked food, or utensils, right? And so again, the kitties, poo in the house, and there's a chance that they walk around because kitties will be on the floor, kind of doing this with their tail. That means that they're conniving and thinking about how they can take over the world. And then you put a piece of meat that you're going to cook for dinner on the table. Then you go check on something, Mikhail, you go check on something, you come back, and the kitty had been up there because they smell everything. Then they paw it, and they might lick it, and then they'll go back down, and they'll do this with the tail, and you never knew they left. But, as long as you cook the food properly, there's not gonna be a problem. Now, for the individuals, like everybody in this room, except for one, it's not a big problem. But if you are pregnant, you should always cook your meals thoroughly if you have a cat. I'm not saying get rid of kitty. I'm just saying the other person in a relationship isn't doing as much work as you are for 9 months. Have them clean up.
Somebody needs to tell him that.
So listen, but listen, you need to inform that other person how to get rid of kitty litter. It should be put into the regular trash and thrown or flushed down the toilet. It is not good
Your cat's potty trained.
to take it outside and just throw it out in the yard for better fertilization. That doesn't work. You're just gonna have the oocyst everywhere.
Our cats go outside, both of them.
Well, Misty doesn't go inside. She will make noise, "Ah!" and that means she wants out. She goes out and she has her own little place in the garden where that place smells bad. Charlotte will only go in her little pristine little kitty litter box, and Charlotte will move everything to the side that doesn't look good to her and leave it like that so my wife can come and remove it that same day, because Charlotte won't go to the bathroom. My wife kept saying, Charlotte's going later and later every day. I said, there might be a correlation to how often you clean that litter box. He goes, that makes sense. And so now if you clean the litter box early for Charlotte, Charlotte goes early. But if you wait till the end of the day, Charlotte goes at the end of the day. Misty
She
goes
doesn't
outside.
play around. She knows her work.
And Misty has her own litter box and never uses it. Ever.
Okay, y'all are trained. They train y'all.
Oh my God.
Yeah.
So here, if you look at them, they are so cute.
Are these your
They are-
cats?
No, these are not
Oh.
mine, but these are looking outside, and they are contriving how they're gonna take over the world, right? It reminds me of that little show. Do you remember the two mice that used to the brain and
Oh,
Pinky and the Brain? It reminds me of that, right? Because Charlotte and Misty don't get along, so they fight through the door. They hiss at each other, but they don't see each other. They don't like each other. It's pretty
Two
interesting.
big personalities, it sounds like.
So here you can see how we might acquire toxoplasma. Again, there's the rat and the bird, and there's the cat, and there's the oocyst. The oocyst can be released in the litter box, or in Misty's case, in the garden, right? Or, you can get on food, and then we can eat them, and so we get vertical transmission. Blood transfusion are very rare because we test for it, so it's not gonna be in the blood. But it is a very frightening thing, because toxoplasma can infect every single tissue of the body. But trending right now is the fact that our immunocompromised patients, our AIDS patients, are going blind by it. Now, I'm not saying every one of them, but I'm saying there's more of this happening than we have seen before. Right? So if you get an exam question that says, toxoplasma seems to affect immunocompromised patients by, and I might give 5 different things. One of them might be causing blindness.
What?
Blindness.
Causing
Blindness.
people blind. Okay? So as we leave this particular topic, which I didn't cover every single infectious agent, it's just hard to do. But I gave you a smattering of really cool things. I just believe that people tend to be like my brother, be a germaphobe, and no matter what happens, they still think that they're gonna have these organisms on them. I am on the other end of that, which just simply am not afraid of anything. And you've seen me eat things off of the floor and all kinds of stuff. I wonder if we gotta figure out if our stuff is still over there in the other room, so that we can bring that
You
up.
can eat it?
I'll eat it. on Tuesday. Okay?
I've always had this fear that like, or not